Can intensive care at home facilitate rehabilitation for tracheostomy patients? My name is Patrik Hutzel from intensivecareathome.com, where we provide tailor-made solutions for long-term ventilated adults and children with tracheostomy in their own homes, and where we also provide home care intensive care for patients on BiPAP, CPAP without tracheostomy, tracheostomy without ventilation, home TPN, home IV, potassium, home IV, magnesium, home IV antibiotic infusions, central line, PICC line, Hickman's line, and port management at home, cough assist management at home, ventilator weaning at home, nasogastric tube management, nasotracheostomy tube management at home, PEG tube and patch tube management at home, as well as palliative care. So today I have a question from Bridget who says, "Hi Patrick, my dad's in ICU and he has been off all antibiotics since Sunday, and they've done another blood draw that they're doing a blood culture on to see if nothing comes up, I'm assuming. Right now his white blood cell count looks good and he still has slight fluids in his lungs. He's been responding more with his Passy-Muir valve, and yesterday was the first day he had it in most of the day, with maintaining blood oxygen levels on his own. My concerns are he still seems sleepy through the day, and after physical therapy, which he only gets 1 hour a day, 3 days a week. He does respond to us with answering our questions, but it's common that he doesn't know how to speak well after having his tracheostomy, or is it also his brain injury causing confusion? Could he still be slowly regaining consciousness too? He isn't completely out of his arm restraints, but they have suggested he go without them while my mum is with him. Given he's too sleepy still, he can't have the tracheostomy removed yet, if at all. He's scheduled to transfer to a short-term rehabilitation program, but when looking at their website, I'm not sure if they're even qualified to look after my dad with the tracheostomy. I think it would be so much better to get him home with intensive care at home for our peace of mind and mainly for his quality of life. Can intensive care at home take him home and facilitate rehabilitation at home? From Bridget. So, hi Bridget, thank you so much for sharing about your dad's situation. Sounds like he's making good progress, especially now that he's off antibiotics, maintaining good oxygen levels with the Passy-Muir speaking valve, and showing responsiveness. Those are all positive signs, even if he still seems sleepy at times. So, let's unpack what's happening and how intensive care at home can help. Firstly, it's very common for patients with a tracheostomy who have been in ICU for a prolonged period to be sleepy or drowsy, especially after physical therapy. Critical illness, sedation, infections, and brain injury can all contribute to this. The brain takes time to heal, and fatigue is a normal part of recovery in intensive care. Keep in mind, he would have been sedated, ventilated for many weeks in an induced coma. There's ICU delirium, ICU psychosis, so be patient. Now, regarding his speech and confusion, this can definitely be due to a combination of the tracheostomy, the brain injury, the overall ICU acquired weakness, and like I said, ICU psychosis, ICU delirium, and the length of time he spent in an induced coma. The Passy-Muir speaking valve is a great step towards communication and eventual weaning, but regaining speech and cognitive clarity takes time and structured rehab, ideally in a familiar, calm, safe, and free from infection environment. That brings us to your key question. Can your dad go home with intensive care at home instead of going to a short-term rehab facility? The answer, of course, is a resounding yes. We have been successfully providing home tracheostomy and ventilator care for over 13 years now in Australia and have helped countless families bring their loved ones home from ICU. Our critical care nurses with ICU or pediatric ICU and sometimes ED experience can manage everything that's currently being done in the ICU, including tracheostomy care, suctioning, monitoring oxygen levels, administering medications, even assisting with physiotherapy and rehabilitation. Also do things like changing inner cannulas, changing tracheostomy tubes, administering nebulizers as well, changing tracheostomy dressings, and the list goes on. And that's, of course, all within the scope of a critical care nurse, which is what is needed for your dad. And it's also evidence-based. When you look on our website at the mechanical home ventilation guidelines, where the only way to take a tracheostomy patient home safely is with critical care nurses 24 hours a day. And those critical care nurses need to have a minimum of 2 years hospital critical care experience. As a matter of fact, rehabilitation at home is often far more effective because your dad will be in a familiar environment surrounded by family, which promotes comfort, motivation, quality of life, and neurological recovery. Many of our clients have made faster progress at home compared to institutional rehab programs. And also we liaise with physiotherapists, speech pathologists, OTs, and other allied health professionals to build a personalized rehabilitation plan at home whilst ensuring the safety and continuity of care. And also, like I briefly mentioned earlier, it's also a cleaner environment. So what do I mean by that? When you look at intensive care, it's a quote-unquote dirty environment because there's countless of patients with infections. So doctors and nurses, no matter how good their hand hygiene practice are, no matter how good their universal precautions are, still the risk of you catching an infection through transmission from another patient is much higher in an ICU than it is at home. So rather than moving your dad to a facility that might not have the expertise for tracheostomy care, you can have peace of mind, quality of life, and rehabilitation, knowing he'll be cared for by intensive care nurses at home 24 hours a day, if needed, should give you the much needed answer and most of all peace of mind that you need. So if you'd like to explore this further, please reach out to us at intensivecarehome.com and we'll review your dad's medical situation closer, liaise with the hospital team, and arrange a safe and seamless hospital to home transfer, including equipment, staffing, funding, and now, with intensive care at home, we are currently sending our ICU and critical care nurses into the home 24 hours a day. We are providing the following: home care services for ventilated adults and children with tracheostomies with critical care nurses 24 hours a day. A genuine alternative to a long-term stay in intensive care or long-term acute care, tracheostomy care for clients without ventilation, home care services for patients on non-invasive ventilation such as home BiPAP, home CPAP, home TPN, which is also known as IV nutrition, home IV potassium and home IV magnesium infusions, IV fluids, and IV antibiotics. We are providing central line management, PICC line management, Hickman's line management, as well as port management at home. We're providing nasogastric tube and PEG tube management at home, the use of cough assist machines for our clients for airway clearance at home, palliative care services at home, as well as ventilator weaning at home. We're also sending our critical care nurses into the home for emergency department bypass services. We have done so successfully as part of the Western Sydney Local Area Health District, their In Touch program, saving approximately $2,000 per patient that we keep at home instead of them going to an emergency department. That also means we're in a position to cut the cost of an intensive care bed by around 50%. An intensive care bed costs between $5,000 to $6,000 per bed day. Our service costs between $2,500 to $3,000 per bed day, and we're freeing up the most sought after bed in the hospital, which is the ICU bed. Most importantly, we're improving the quality of life for patients and their families, which is a win-win situation for all stakeholders. Of course, quality of life is much improved surrounded by families and by a team of dedicated intensive care nurses in the home care setting instead of in an intensive care unit. With intensive care at home, we are currently operating all around Australia in all major capital cities as well as in all regional and rural areas. We work with NDIS clients all around Australia, TAC and WorkSafe in Victoria, Department of Veteran Affairs all around Australia. Our clients and we as a service provider have also received funding through public hospitals, private health funds, as well as departments of health. We are having policies and procedures for intensive care at home nursing, and we've built all the intellectual property for intensive care at home since 2012. No other provider in Australia has created more intellectual property when it comes to intensive care at home nursing than we have. This puts us in a position to employ hundreds of years of critical care nursing experience combined in the community. No other service provider in 2025 employs a higher skill level in the community than we do, which enables us to look after the highest acuity adults and children in the community in Australia safely. So if you're at home already, and if you're watching this, or you're stuck in an ICU long-term, or if you're going to hospital and ED all the time, and you realize that you don't have the right level of support at home, or if you are stuck in an ICU, I'll give you a real-world example today how we can help you. One of our first clients when we first got started in 2012 was a client who was at home initially on a ventilator with a tracheostomy with a support worker model 24/7. Of course, support workers are not equipped to look after a client at home on a ventilator with a tracheostomy. That is dangerous and it's simply negligent. Having support workers looking after a client at home on a ventilator with a tracheostomy is like flying the airplane with a cabin crew instead of the pilot, because anyone on a ventilator with a tracheostomy is at very high risk of medical emergencies 24/7, or even at high risk of dying if they don't have a team of dedicated critical care nurses looking after them 24/7 at home. This is actually evidence-based and is documented in our mechanical home ventilation guidelines that you can find on our website at intensivecarehome.com. Think about it. In an intensive care unit in a hospital, you wouldn't have support workers looking after your critically ill loved one or after any critically ill patient on a ventilator with a tracheostomy. So why would anyone in their right mind do that in a home care environment in the community? So this client at the time found out about us eventually, and the ICU that he was basically living in also knew about us and eventually reached out to us. And we were proving our concept with this client very fast. When we worked with this particular client, we sent him critical care nurses 24 hours a day, and he never ever went back into ICU ever again as long as we were working with this client. We can do the same for you if you're not safe at home and help you with keeping you at home predictably. Otherwise, we would not be in business. Again, the same is applicable for those stuck in an ICU, similar to this case study that I've just given you. Or if you're going back to ED all the time, please reach out to us. We can help you with taking you through the right steps, including how to get funding with different funding bodies. This is also why we are providing NDIS support coordination. We have a team of NDIS support coordinators, and they have a wealth of knowledge. I've done an interview with Amanda Richards, one of our NDIS support coordinators, and I'll put a link to an interview with Amanda in the written version of this blog. We're also providing TAC case management and WorkSafe case management in Victoria with Lucy McCodder. If you're an NDIS support coordinator or a case manager from another organization watching this and you're looking for nursing care for your participants, please reach out to us as well. If you need more evidence for nursing care, we are also writing NDIS nursing assessments with legal nurse, critical care consulting nurses. If you are a critical care nurse and you're looking for a career change and you want to join a very progressive, dynamic, and high-performing team of critical care nurses in the community, we're employing hundreds of years of critical care nursing experience combined. You can join this high-performing team if you are a critical care nurse. If you are looking for a career change as a critical care nurse, we're currently hiring for jobs for critical care nurses in Melbourne, Sydney, Brisbane, in Albury, Wodonga, in Bendigo, in Geelong, in Warragul, in Victoria. If you have worked in critical care nursing for a minimum of 2 years, pediatric ICU, ED, and you have already completed a postgraduate critical care nursing qualification, we will be delighted hearing from you. I do have a disclaimer though, because we are offering a tailor-made solution for our clients, which includes regular staff. Our clients also do want the same staff coming over and over again because they are so vulnerable and so special. That's why we need regular staff. So if you're looking for agency work where you can come and go, this will not be the right fit for you. We are looking for consistency and our clients are looking for consistency. So please only apply with us if you can give us regular and consistent availabilities for shifts and you're really keen on building solid relationships with us and with our clients. If you're an intensive care specialist or an ED specialist, we also want to hear from you. We're currently expanding our medical team as well. We can also help you eliminate your bed blocks in your ICU and in your ED for your long-term patients, or for your regularly readmitting patients with our critical care nursing team at home. We're here to help you take the pressure off your ICU and ED beds, and in most cases, you won't even pay for it. Even if you do pay for it, it is so much more cost-effective than what you're paying for in ICU and ED, and you get the same level of care. And if you're a hospital executive watching this and you have bed blocks in your ICU, ED, and respiratory wards, or for home TPN, please reach out to us as well. We can help you eliminate your bed blocks very fast. If you're in the US and in the UK, and you're watching this and you need help, we want to hear from you as well. We can help you there privately with one-on-one consulting and with hiring nurses privately. Once again, our website is intensivecareathome.com. Call us on one of the numbers on the top of our website, or simply send us an email to info@intensivecareathome.com. And if you like my videos, subscribe to my YouTube channel for regular updates for families with intensive care at home and intensive care. Click the like button, click the notification bell, share this video with your friends and families, and comment below what you want to see next or what questions and insights you have from this video. Thank you so much for watching. This is Patrik Hutzel from intensivecareathome.com, and I will talk to you in a few days. Take care for now.